I was looking at breastfeeding rates in Pakistan, how at the hospital specifically can we increase breastfeeding rates, given some of the current standards and practices that the World Health Organization recommends as far as breastfeeding goes, and then some of the specific cultural barriers that Pakistan faces, and the things that I believe, and then we'll look at what I created at the end of my project. So currently the World Health Organization recommends that breastfeeding is initiated within the first hour of birth, so right away. This has a lot to do with milk production and also stimulating hormones to be released in the body that are involved in milk production, and then also so that infants are exclusively breastfed up until 6 months old. And exclusively breastfeeding means you're only giving them breast milk, you're not giving them any other kind of supplement or different milk formula, anything like that. And then infants should breastfeed up until they're 2, supplementing at 6 months, and then breastfeeding until they're 2 years old and beyond. And they're very, I think the last point is probably more controversial when it comes to practical aspects of breastfeeding. But currently, here's a chart of breastfeeding rates worldwide. And I have Pakistan highlighted, circled there for you if you are unsure where it's at. And a lot of countries are not at the 60 to 79%. There's very few that are. A lot of them are more in the 40s to 50s percentage as far as the amount of babies that are being exclusively breastfed until they're 6 months old. Pakistan is the second shade of pink, I guess, it's the lightest shade of pink. Where it's there as a country, they have about 40 to 59% breastfeeding rate. And actually the US is not doing so hot itself. And these are stats as of 2023 from UNICEF. And the country as a whole, Pakistan, is in this 40 to 59% range, but the specific district that I was looking at has lower breastfeeding rates, which is part of the reason that the doctor talked to Joy about helping them increase their breastfeeding rates. Here's a graph. You can see the World Health target by 2030 of where they want the world to be at with exclusive breastfeeding rates, and then the trends that have been happening, and also some of the current percentages of certain markers of exclusive breastfeeding as compared to where they want to be in 2030. In Pakistan, as of a 2017-2018 survey, about 48% of children are exclusively breastfed. But in the specific district in Punjab where the hospital is located at, this can range from, depending on the source that you're looking at, from 17 to 44%. It's a really big percentage, but I was having difficulty finding a lot of numbers on their exact percentage. The Pakistan's governmental website said about 28%, but I wasn't able to access it personally to verify that, which is why I didn't include the number on here. And there are some papers from 2019 that said about 44%. There's one from 2016 that said 17%. And so it seems like they're not entirely confident on what the actual numbers are, but it tends to be lower than the country as a whole. Some of the things that make breastfeeding challenging and the exclusive breastfeeding rates challenging in Pakistan is that pre-lacteal feeds are a very common practice. By this I mean giving the baby something other than breast milk right after they're born. So something like honey water or goat's milk or rose water, because they think that colostrum, which is the first milk the first kind of milk that is produced when the baby is born, they think it's stale because they think it's been inside your mom's body for a while, and so they don't think this is great, and so they're like, we're going to give you something that has a lot of sugar in it because sugar is important. But colostrum is actually really important because it contains the highest concentration of fats, amino acids, protein, a lot of immunoglobulin concentration, factors that protect the baby against disease. And so instead of giving the baby this, they give them something like honey water. Not only is it a lot less nutrient rich for the baby, but it also has a high risk of contamination. So you're kind of like a double injury. You give something that is a lot less helpful for the baby in developing, but then you also increase the risk of contracting disease. And then this also affects milk production for the mom if she's not breastfeeding right away, going back to that first point about initiating breastfeeding within the first hour of birth. There's also lack of education is often a barrier. There are not very high literacy rates. About 50% of the people are literate. And also women aren't coming in for prenatal checkups, which is a common practice here in the US, where moms are gonna go in before they have their baby, and that's a great time to get education about how you should feed your baby. And so studies have shown that a really great time to do breastfeeding education and to change mindsets about breastfeeding is doing education before the baby is born. Because if you do it afterwards, the mom's overwhelmed. There's a lot of new information. There's a lot of like hormones going on. She's tired. She just like worked really hard for a long time. And so that's a struggle. They're also a collectivist culture, and so what their family might say about breastfeeding, or what their mother or mother-in-law says about breastfeeding, they're gonna consider more strongly than what someone from the hospital might say, or what educational sources might say. And then also, as Dr. Bennett mentioned, promoting breast milk substitutes, so formula advertising has done a lot to harm breastfeeding rates, and especially because if you see a gloriously chubby white baby on a formula advertisement, you probably think that your baby could end up looking the same way. And depending on where you're from, being like the West is really exciting. And there was a lactation consultant that I interviewed, that I was able to interview from Pakistan, and in an interview I didn't do, but someone else said, she said that village women will do anything to purchase formula, even if it means borrowing money and taking on debts, because they believe the only way to have their babies turn out like the beautiful chubby child they see on the formula boxes is by supplementing with formula milk, which is really sad because formula actually contains a lot less nutrients, fats, protein, sugars than breast milk does, and breast milk is actually much better for development. Children who are breastfed tend to have higher rates, higher IQ scores, lower risk of contracting future diseases. So there's a lot of really great benefits with breastfeeding. And one of the last limitations that Pakistan has is that just in general, their healthcare system is lacking. Either they're understaffed or might have limited education, or they have a lack of financial resources to implement some of the things that would be helpful with increasing breastfeeding rates. And also they just have a lack of like people who are specifically helping women with breastfeeding. Nurses and midwives might, but here in the US we're used to lactation consultants who are specializing in breastfeeding. And the first lactation consultant in Pakistan, their first IBCLC, is this woman. I was able to talk to her a few times. Her name is Zora Kurji, and she didn't become a lactation consultant until 2018, which is really quite shocking when you think of the things we have access to here. So all these effects on breastfeeding, the biggest thing is basically it counteracts the breastfeeding supply and demand. So if your body generally is not going to make something unless it knows you're going to use it. And so if you're not removing milk, if you're not telling your body that you need to make milk, it's not going to make it. And so if you're not breastfeeding the first hour, you're not removing milk, you're not really telling your body to produce milk. If you're not breastfeeding often, or if you're breastfeeding somewhat, but you're also supplementing with other things for your baby, your body's not going to produce as much milk. It essentially regulates through hormones and signals that are external signals that it receives to make as much milk as your body needs. And so all of these factors are affecting this, and a lot of women have the perspective that they can't produce enough milk, and so they begin to supplement with formula, or they give cow's milk or something to supplement what they think is a deficit in what they have. There are some UNICEF policies, World Health Organization policies, that I looked at. These are basically ways that they're trying to increase breastfeeding rates, and this kind of informed the research that I ended up doing and the work that I did. Some of the big ones are basically just increasing education and also making sure that hospital staff are well equipped to help moms with breastfeeding. And they have, on the bottom, there's 10 successful steps to breastfeeding. And this has a lot to do with maternal education, family education, staff education, and specific ways to educate and support mothers. And I will, for sake of time, not really go through these all, but the question that I then wrestled with was, how do we increase breastfeeding rates given the limitations that they have and also the cultural context in Pakistan? And my hypothesis was that by increasing education for hospital staff and for mothers, there's a midwifery school connected with the hospital, and a lot of the midwifery students and midwives at the hospital help mothers with breastfeeding. So increasing their education through a textbook that they have, also creating posters that are visual images in this less literate culture, and then also giving mothers booklets that they can take home that can be helpful for them to look at. All these combined can increase breastfeeding rates at the hospital. So the first thing that I did was I worked on taking what they currently had, the information that they currently had in the textbook, and I made it more robust. They had about a 15-page textbook that was given. A lot of the pages were like this. They're not very densely packed with words, and they have some figures, but some of the information that they had was very basic or not even non-existent. And so I took this and I essentially wrote about 25 pages. I added some sections. Some of the sections that I talked about were just simply anatomy, physiology of lactation. I looked at how an infant's mouth develops, and so how that affects with like latching and good breastfeeding, and also highlighting the benefits of breastfeeding, and also components of human milk. And I looked at family support. I looked at skin to skin, how to increase milk production, and essentially basically taking hopefully some of the most important components and helping midwives themselves be better educated. I also created some posters, 4 different posters, some on breastfeeding positions, and given some of the cultural sensitivities, we had to be creative with some of the images we drew. Carrie helped me with these. Shout out to Carrie. And essentially talked about family support, how mothers know that their baby is being adequately, has enough milk so that they're not worried, and supplementing with formula as well. And then also positions and how to know that their baby is breastfeeding well. And then I also created an educational booklet, and I had different topics that I looked at. And again, it's similar in some ways to the textbook, but it's a lot more basic, hopefully a lot more figures and less information and things that they can still understand. And a lot of this was focused on milk production, how that they know their baby's getting enough milk, and also some of the benefits and also some things that the U.S. does, which just like, how often shall I feed my baby? Like, how much should my baby be eating? How do I know that my baby's getting enough to eat? And then I also, with Dr. White's help, Dr. Sarah White, I also created a survey basically to assess like how much have mothers' perspectives on breastfeeding changed since they've been able to see posters and look at booklets, and then also have the midwives themselves done a better job at helping mothers, and also a skin-to-skin time, which is that first hour after birth, like, is that getting better? I interviewed one of the midwives there, and they said sometimes mothers will put a baby on, or the staff will put a baby on the mother for like 5 or 10 minutes and call it good, and then they'll take her again, and then the mother won't be with the baby. So the first hour after birth is very crucial and important. And so I created questions. This is a sample question, depending on the response. Some of these are not, you don't go through, basically you'll skip past some of these questions, but essentially looking at how much skin-to-skin time has the mother had, and if the baby, and breaking these down into trying to make them very clear, so that there's not a lot of like confusion in the questions, and saying to the baby, was the baby on you? Was the baby wearing clothes? Was it not? How long? What was the total amount of time that you held the baby? Did you breastfeed? Like, was this connected? And so thinking about if the skin-to-skin times are improving, but the breastfeeding rates are not improving, thinking about like what other factors might be affecting some of these exclusive breastfeeding rates. And this was one of the goals of the survey. And then I also asked a question for the midwives, and basically asking them to self-assess what they did, also to fact-check some of the times that the mothers wrote a report, and assess whether midwives themselves were being more helpful, or if they also were, if there was a change seen in the amount of education that they were giving to mothers. That is what I created, and here are a ton of people who helped me. Dr. Bennett, especially, with a lot of brainstorming and guiding me along the way with some of my challenges. Dr. Sarah White also gave me a ton of super helpful feedback on creating the survey, some of the clinical aspects of what I created. And then I was also really grateful to interview the lactation consultant from Pakistan and to get her firsthand experience and feedback and information on what I did. And then also worked with a nurse and Dr. Michelle Walsh over in Pakistan, and there were a few of their midwives that I was able to interview and communicate with a little bit as well. And then I had one of Dr. Bennett's associates give me feedback on my survey or her colleagues, and then I was also able to shadow people, and also had someone who gave me permission to use some of her artwork in my textbook, which I was really grateful for. Thank you.